Madam President, I rise today to speak in support of the Comprehensive Action and Recovery Act of 2015, known as the CARE Act. Our country is facing a prescription drug epidemic, and today is a good step towards addressing this crisis. This is a crisis that I have been dealing with since my days as governor of the great state of West Virginia. Opiate abuse is ravaging not only my state, but this entire country. Our state has been hit harder than most any other state in the country. Drug overdose deaths have soared by more than 700% since 1999. We lost 600 Americans, 600 West Virginians, to opiates last year alone. But our state's not unique. Every day in our country, 51 Americans die from opioid abuse. And since 1999, we lost almost 200,000, think about that, 200,000 Americans to prescription opioid abuse. That's larger than any city that we have in the state of West Virginia. This bill is an important first step. First of all, it will authorize $77.9 million in grant funding for prevention and recovery efforts. It will expand prevention and educational efforts, particularly aimed at teens, parents, and other caretakers in aging populations, to prevent the abuse of opiates and heroin, and to promote treatment and recovery. It will expand the availability of naloxone to law enforcement agencies and other first responders to help in the reversal of overdoses to save lives. It will expand disposal sites for unwanted prescription medications to keep them out of the hands of our children and adolescents. It will launch an evidence-based opiate and heroin treatment and intervention program to expand best practices throughout the country. It will also strengthen prescription drug monitoring programs to help states monitor and track prescription drug diversion. While this bill is a good start and addresses critical problems, Madam President, there is more that needs to be done. I will be offering several amendments to improve the bill by changing the FDA's mission, providing grants for consumer education, and requiring prescriber training. I firmly believe that we need cultural change at the FDA, and that is why I introduced the Changing the Culture of the FDA Act. Simply, it does exactly what it says. It changes that culture. My amendment to CARE, based on the Changing the Culture of the FDA Act, would amend the FDA's mission statement to include language that will require the agency to take into account the public health impact of the nation's opioid epidemic when approving and regulating opioid medications, and will hold the agency for addressing the opioid epidemic. It's hard to believe that right now, as all these new drugs are coming to the market and all these pharmaceutical manufacturers are producing this new product, that basically the mission statement has never been to take into account public health and impact of the nation's opioid epidemic. And now that we see it, truly an epidemic, we think this is a most needed change, and hopefully it'll be approved. This builds on and solidifies the FDA's recently stated goal of fundamentally re-examining the risk-benefit calculations for opiates and ensuring that the agency considers the wider public health effects. We need a change, Madam President, in culture of the FDA, but we also need to make sure our advocacy groups who fights this battle every day are armed with the resources they need to stem this tide. I'm also introducing an amendment that would establish consumer education grants through the Substance Abuse and Mental Health Services Administration to raise awareness about the risk of opiate addiction and overdose. This epidemic is one that needs to be fought on all fronts. But most importantly, we need to fight it on the front lines with the prescribers, those people who we trust and the training they need. That is why I'm also introducing an amendment that would require medical practitioners receive this needed training on the safe prescribing of opiates prior to receiving the renewal or renewing their DEA registration to prescribe controlled substance. If you talk to any of our medical physicians throughout the country, they get very little training as far as in the effects of these drugs. And we think it's well past time that they get the needed education and the continuing education so that we can keep ahead of the prescriptions that they're putting on the market and basically the harm they're doing to people every day. According to the National Institute of Health, in 2012, more than 259 million prescriptions were written in the United States for opioid painkillers. That equals one bottle of pain pill for every U.S. adult. Can you imagine one bottle of pain pill for every U.S. adult in this country. It is unbelievable. We are the most addicted nation on earth. 5% of the population in the United States of America, there's 330 million of us, 7 billion humans on planet Earth. We consume 80% of the opiates in the world. It's just unheard of. Until we ensure that every prescriber has a strong understanding of safe opiate prescribing practices and the very great risk of opiate addiction, abuse, and overdose death, we will continue to see too many people prescribed too many of these dangerous drugs, which can lead them down the tragic path of education. There's one other subject I wanted to speak about, and I'm hoping that the FDA and this administration will look at it very seriously, and that is one that basically says that we have these professionals. They're called advisory committees. When an opiate is coming to market, I believe, and I believe a lot of Americans believe, this goes through a review process. These professionals basically are looking at this. They make a recommendation whether this drug should be on the market, the need for this drug, and the effect that this drug has on basically people's lives. If they rule against this drug, and let's say they have 11-2 ruling, such as Ohio did, then that request for that drug to come to market should have to come before Congress. And for the FDA, the director and their staff, to basically come and explain to Congress why this potent piece of, this potent drug needs to come on the market, when basically their advisory committee and those people who are the professionals basically agree not to let it come to market. This is a conversation that has to be had. We have to make sure that we understand why we're putting all these products on the market and the effect that it's going to have. So that's another topic that we hope to talk to also as this bill comes on the market. The bottom line is I'm pleased that the Senate is addressing this epidemic, and I'm glad the Senate is working in a bipartisan manner. This is how we need to work to solve the major challenges our country faces. By working in a bipartisan, we will have, I understand, an open amendment process, which is so needed and critical for us moving needed legislation through. I appreciate that, and I believe my amendments will strengthen this bill, but I also believe more needs to be done. We must provide the critical resources needed to stem this tide. I look forward to working with my colleagues to strengthen this bill and to begin to address this crisis head on. Madam President, this country has faced every crisis we've ever had, and we've overcome it. This is one we haven't attempted. For some reason, it's a silent killer. It's out of sight, out of mind. It's going to take all of us. It's going to take all of us being Americans and putting basically our faith that we have that we can fix these problems to save Democrats, save Republicans, save independents, save everybody. This cannot be a partisan issue, because I can tell you, opiates and the addiction of opiates has no partisan home. It is truly bipartisan. It attacks us all. So, Madam President, I appreciate this, and I look forward to working with you through this important piece of legislation, and I notice the absence of a quorum.